Good afternoon, everyone. My name is Lee Babes E. Patalipog. I'm a first-year nursing student from Bravo Doctors College, and today I am going to demonstrate how proper hand washing should be done. But before anything else, let me give you a short description on why hand washing is important. Now, hand washing is the best way or method in preventing and lessening the spread of microorganisms. It also reduces the risk of transmission of microorganisms to the patient, cross-contamination of microorganisms among the patient, and transmission of infectious organisms to the patient and, of course, to the healthcare provider. With that, let's proceed to the hand washing process. Okay, so before we proceed, let us ensure that all of our supplies are complete. That includes the soap, the running water, and of course the paper towel to dry our hands later on. Okay. While standing in front of the sink, we should make sure that our uniform is not touching the sink, as the sink is considered as a contaminated area. Now, if our uniform touches the sink, our uniform will then be considered as contaminated, and the microorganism with us will be brought along as we go to place to place. After that, we should make sure that we are no longer wearing any accessories or jewelry, as bacteria and microorganisms are prone to lodging at that area. After that, let us check if we have any abrasion, any small cuts or wounds, and if there is none, we may proceed to the hand wash. Okay, first is turn on the faucet, making sure that we control its force, so that way our uniform will not get contaminated from the water splashing on the sink. Okay, now let's wet our hands, making sure that our fingertips are pointing at the bottom of the sink, and our hand is always above of our elbow. Okay, we are following the principle of from the least contaminated to the most contaminated area. Okay, after wetting our hands, let's grab a generous amount of soap and then lather it to our hands, or palm to palm, in a circular motion. Okay. After that, we are going to proceed to the back of our hands, making sure that we are interlacing our fingers, and that way we are really going to the nooks and crannies of our hands. Okay, we can do that with the next hand. Okay, after that, we are going to interlace our fingers and then rubbing it palm to palm, like so. Okay. After that, we're going to proceed to the back of our fingers, and to do that, we are going to interlock our hands and then rub the back of our fingers. We're going to do that to both of the hands, like so. Repeat to the other side. Okay. After that, we're going to proceed to our thumb. Now, in cleaning our thumb, we're just going to grab it, and then we're going to clean it in a rotational manner, like so. We're going to do it to the other thumb. Okay. After that, we are going to clasp one of our hands and then rub it to the opposite palm in a circular manner. This is really to ensure that we are really getting rid of all the dirt. Okay, we're going to do that to the other palm. After that, we're going to proceed to our wrists. Now, in doing our wrists, we're just going to clean it in a rotational manner. Okay, after spreading all of those completely, we are going to rinse it off. Now, in rinsing it off, again, pointing down, and we should make sure that there are no longer soaps in our hands. Make sure that there are no dirt left, and we are really completely rinsed it off. And of course, we are then going to avoid splashing with water, then again, this will contaminate our use. Okay, after doing so, we're going to pat our hands dry using a paper towel. Grab one, and then let's dry from fingers to palm to wrist. Now, since my paper towel is quite thin, I'm going to have to do this again. Okay, now the used paper towel should be thrown away. Grab another one and then dry it. Okay. After making sure that our hands is completely dry, to avoid remaining moist in our hands, so we should make sure that it's completely dry. Throw it away. For the last tissue, we are going to use this as a handle in holding the faucet and then turning it off. Right? This is to ensure that we are no longer holding any contaminated area in the faucet or in the sink. Because then again, tissue, because then again, our hand is completely washed. Therefore, it is really cleansed. Now, if we are going to touch our washed hands in the sink, our hands will then be considered contaminated, and we are going to repeat the process. Now that's how you do proper hand washing. Thank you all for watching.